Hey everyone, let's talk about something we don't usually bring up at the dinner table: diarrhea. It might be awkward, but understanding it can actually save lives. So let's break it down step by step. First, what is diarrhea? Simply put, it's when you have loose, watery stools more often than usual. Most people get it at some point, and while it usually isn't serious, it can become dangerous if not managed properly, especially for kids and older adults. So, what causes diarrhea? Well, the most common culprits are infections. Think viruses, bacteria, and sometimes parasites. Food poisoning, contaminated water, and even certain medications like antibiotics can also trigger it. Some people get diarrhea if they're sensitive to certain foods or have underlying health conditions like irritable bowel syndrome or inflammatory bowel disease. Common bacteria causing diarrhea include Escherichia coli, Salmonella, and Shigella. Common viruses include norovirus and rotavirus. Treatment usually involves staying hydrated. For bacterial infections, doctors may prescribe antibiotics. For viral causes, rest and fluids are key. Always consult a healthcare professional before taking medication. Now, how do you know you're dealing with diarrhea? The main sign is obvious: frequent, watery stools. Other symptoms can include stomach cramps, bloating, nausea, and sometimes fever. You might also notice dehydration, which shows up as dry mouth, feeling really thirsty, or peeing less than usual. If diarrhea lasts more than a couple of days, or if you see blood, have severe pain, or signs of dehydration, it's time to see a doctor. So, how do doctors figure out what's going on? They'll usually start with a few questions, and sometimes they'll ask for a stool sample to check for germs or other clues. Blood tests might help if you're really unwell or if you have other health issues. Let's talk about treatment. The main thing: stay hydrated. Drink water, oral rehydration solutions, or clear broths. Avoid caffeine, alcohol, and super sugary drinks. They can make things worse. For most mild cases, you'll start feeling better in a couple of days. If it's caused by bacteria or parasites, a doctor might prescribe specific medications. Managing diarrhea at home is mostly about self-care. Rest, eat light meals, and don't stress about eating if your stomach isn't ready. And remember, wash your hands often to prevent spreading germs. So while diarrhea isn't a glamorous topic, knowing what to do makes a huge difference. If in doubt, don't wait. Reach out to a healthcare professional. Thanks for watching, and take care of your gut.